welcome back to another episode of Black Health. I am your host, Dr. Michelle Kirwan Bythwood, board-certified pediatrician and recent past chief medical officer of a federally qualified health center in Miami Gardens, Florida. And today we are talking about safety net hospitals and health equity. And to do so, we have Dr. Sandra Severe. She is the Senior Vice President and Chief Executive Officer of Jackson North Medical Center Hospital, an acute care hospital located in North Miami Beach, Florida. And it is affiliated with the world-class Jackson Health System, one of the nation's largest public health systems. Welcome to the show, Dr. Sandra Severe.
Good morning. Thank you so much for having me. I truly appreciate it. It's a pleasure.
Thank you. Thank you for joining us. I know you have a very busy schedule, so thank you for taking time out of that. Dr. Severe, you've built an incredible career across public health, children's services, hospital administration. I'm curious to know what inspired your path into healthcare leadership.
It almost stumbled, in my lap, if you will. So I initially, when I was in high school, I did take part in HOSA, Health Occupation Students of America. And that was really kind of my first, introduction into healthcare, not necessarily leadership, but clinical. So we did a lot of, we went to nursing homes, we went to hospitals to really learn the fundamentals. And at the end, you got a license and to become a certified nursing assistant. So that was my first kind of taste. Went on to college. And, my mind was set. I was going to be a lawyer. Life happened. And in between sort of that my senior year, and I was going to do a year and study for the LSAT. And I said, you know what, I couldn't afford kind of to do a gap year. That just wasn't my family's background. So I decided to stay at my university. I went to Tulane University in New Orleans and got accepted into a master's in public health program. And there I fell in love. I fell in love with the concept of community-based health, the concept of that, the concept that health is not one, it is population.
Yes.
If we take care of one, we take care of many. And from that, I came back home. Anyone can tell you, if you're in public health, most of us, our dream is at the time, maybe it's changed, is to go to the CDC and work there. I didn't realize that that's a whole process in and of itself. And so I came back home to Miami and looked for a job. It was very difficult. And I ended up being selected to become an operations manager for a program for children with special needs at Miami Children's Hospital at the time, now Nicholas Children's.
Yes.
And that's how I got into it. And I've been in healthcare leadership ever since.
And you're a native of Miami, correct?
I am.
So what does it mean to you personally to now lead one of its cornerstone hospitals?
It's whenever I get asked that question, I reflect on the fact that my family, I was the first one born in the States, and my family's from Haiti. And what it means to me is that care transcends, particularly at Jackson, care transcends who you are, where you come from. It's about saving lives. And my mother, she went to an FQHC. At the time, I want to say it was Juanita Mann. And
I did my residency at Juanita Mann.
All right, so and she didn't speak much English, and she was here legally, but resources as such, and she was here alone. And they said, "You're at 26 weeks, your baby isn't moving," and they said, "You need to go to Jackson immediately." She took a little while because, of course, being fearful. And she went about a week later and immediately went into the NICU and went into, she had preeclampsia. So she ended up delivering me at Jackson, and Jackson essentially saved both of our lives. So it's hard to put into words and in sort of like a clean sentence what it means to me. It really is full circle. I get to give back to the institution that saved my life, saved my mother's life, particularly in the 80s, being born at 26 weeks. That's it's
That's,
impactful to be here today.
it is, even just being born at 26 weeks. That's very
Yeah.
early, actually for then. Now 24 weeks, they're saving babies. But so for listeners who may not know, what makes a safety net hospital like Jackson North so vital to the community? And I think your story about your mom speaks to it as well.
Absolutely. Well, here's the thing. What makes what we do unique is that our goal, our mission is to provide care, one single standard of care, regardless of your ability to pay, who you are, where you come from. When you walk through those doors, our goal is to impart health, to save life, to ensure that you walk out your optimal self. That's what makes us unique. It doesn't matter who you are. And like I said, it's embedded in the mission. One quote, I love mentioning this because it was really powerful, even just for me to hear as an employee. Our chief executive officer for the system, Carlos Magoya, once said, we're a hospital where in one room you can have a diplomat, a world diplomat, and in the next room you can have a homeless man.
Mm.
And they're being treated by the same physicians,
Yeah.
the same nurses,
Yeah.
and they both can walk out with a new lease on life.
That's amazing. And that is so true. And I love that you talk about, how you treat anybody, because North Miami and Miami itself is home to diverse populations, Black, Caribbean, immigrant families. How does Jackson North tailor their care to meet the unique cultural and potential socioeconomic needs of these communities?
So, when you look at healthcare, one of the key things you'll often hear is about representation.
Mhm.
People want to feel that you understand them and that you care for them. And a lot of times that happens by putting them in an environment or offering them an environment that feels like home, that feels familiar. So for us, we have a diverse staff. We have not just staff as in nursing, tax, people who clean, our physicians. So in our particular demographic, we have a large Black, African American, Haitian, Jamaican, all the parts of the Caribbean, large Latin. We're starting to see more Latin, those from Latin countries come in. We also have a large Jewish contingent. So when, let's say for our Jewish brothers and sisters, we have a Bikur holy room, which, has kosher foods when families are visiting. We have an elevator, a Sabbath elevator. So if they're here on the Sabbath, it allows them to adhere to the customs, although their loved ones may be in a hospital, right? We have Creole speaking staff members. We have phones, devices that allows us to reach the patients where they are. And then, of course, as I mentioned, our staff, right? We have Creole speaking staff, Spanish speaking staff. We're starting to we have a couple of staff members who speak, Russian or Ukrainian. So that's what makes what we do unique, right? Is that we're you feel some sense of connection, and that's one of the ways that we connect to the community.
I didn't know that about how you cater to the Jewish population. I have never heard that for a hospital system. Never. I've never heard that. That is amazing that you do that. I know in Miami, and in my work at an FQHC, we had Creole speakers, we had Spanish speakers. You had to hire for that in order to serve the population that we served. We didn't have a high Jewish population, but it's just very interesting to hear that in a hospital. I've never heard that. I think that's amazing. That's
Yeah,
amazing.
and even in that, one thing I will say about that. So speaking of the Jewish population, they have it's called Hatzalah, which is almost their own ambulance
Yeah.
service, and so we've connected with them, built that trust. So if they're in that area, a family member calls, they're coming here, and they know they're going to get that care, sitting with the rabbis, and so it's interesting. So it's not just like a racial,
Yeah.
but cultural.
Yeah.
Uh,
I love that. And that's a reflection of who we are in Miami and in the Miami area.
Absolutely.
So some of these populations that we're talking about have significant health disparities. What, in your experience, do you see are the root causes of health disparities? Chronic disease, maternal health, mental health. We see these disparities in Black and underserved communities, especially here in Miami. What do you see as some of the root causes in your experience?
Access. That's the number one thing I'm going to tell you. And I'm gonna and let me qualify it. Oftentimes you'll hear individuals say, well, let's educate. Education is important. It absolutely is. But I can educate you on how to eat, right? I can educate you on why it's important to get a mammogram. But what happens when the nearest grocery store that provides affordable fruits and vegetables is miles away and you don't have transportation? What happens when you can't get an appointment to get a mammogram, right? So we have to be able to, again, I'm going to continue to say this, meet people where they are, whether it be mentally or physically, or just geographically. So that, to me, we talk about in healthcare, the iron triangle, right? And that's access, quality, and cost. And the theory is that one, you can get two, it's very difficult to get that third. And it's very true. It's almost a perfect scenario. If you can get people access to quality care at an affordable cost. But if I can get you that good quality and you have that access, you're probably paying a little more. So it's all of those different things. But the number one for me, when we talk about these communities, is access. How can I get you what you need? And then let's educate them.
So before I ask you the next question, let's actually take a quick commercial break and pay some bills. You are watching Black Health. We are with Dr. Sandra Severe, CEO of Jackson North Medical Center, and we will be right back.
Welcome to the City of Miami Gardens, where purpose meets opportunity. From building tomorrow's infrastructure, to answering the call when it matters most, to creating vibrant spaces and smart growth, every role counts. With 4-day work weeks, 100% paid health benefits, generous PTO, and a Florida pension plan, the City of Miami Gardens puts you first. Join the team that's shaping the future.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman & Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids, matters, because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. The Mesman & Dover Law Firm, youraccidentattorneys.com.
The Great Jamaican Jerk Festival, presented by Publix and VP Records, is back on Sunday, November 9th at Miramar Regional Park. Come enjoy mouth-watering jerk cuisine, exciting culinary demonstrations, and live performances featuring the Wailers, Romaine Virgo, Destra, and Mr. Vegas. Tickets on sale now at jerkfestival.com. The Great Jamaican Jerk Festival. Come for the food, stay for the fun.
Brought to you by these fine sponsors.
Welcome back. You are watching Black Health. We are joined today by Dr. Sandra Severe, CEO of Jackson North Medical Center. Dr. Severe, many safety nets face tight budgets, but big expectations. How do you approach doing more with less and still maintain the quality and the compassion that you spoke about?
Okay, the first thing is efficiency. There is a lot of waste in healthcare, and so and when I say waste, let me be very clear. Wait times. So it's not just waste as in like we're wasting paper or we're wasting money. No, but the time it takes to get to an appointment, right? Because of the roadblocks or the red tape, insurance, right? Getting someone insured before they come in, before they get a procedure. So you're waiting a good amount of time. So for us, the first thing we really do is we do look at, okay, how do we do the most, not necessarily with the least, but instead, how do we shrink the time frame that we have to do it? How do we do, yes, more with less, but highest quality? So that's one of the first things we do. I'll give you an example to really illustrate my point. Before someone comes in for surgery, we have to do a lot of pre-clearances. And so one of the things that we found was, we're getting one level clearance, but let's say we're not optimizing to make sure, did they get their blood pressure checked 2 days before versus, within the past hour. And then you get them in, you take that blood pressure within that hour, and we find out it's too high, they can't go into surgery. So let's put in place a process that allows it to flow. So that's one of the key things, really honing in, looking at process improvement. Two big areas where we do that is Lean and Six Sigma. And those are two performance improvement concepts. One is to optimize performance and one is to eliminate waste. And so we look at redundancy. Are we doing the same thing more than once? Are we asking the same question over and over again? So if a nurse comes in and she's taking your blood pressure, and then the patient care tech taking your blood pressure, physician taking your blood pressure. So how can we reduce duplication of efforts? The other thing is really people management. We try our best to use people or to operate at the top of an individual's license. Okay. So that's very important. Can a nurse, if we're working with a nurse, can we make sure that we're using all her skill set, right? Instead of, half of it, and therefore we have to hire more because we're not maximizing. So people management is a really big part of how we do this work. And of course, and I can go on and on, there's so many others, but I would also say technology, making use of technology, whether it's, increasing our telehealth capabilities. So think about it. As a physician, sometimes you don't always need to lay hands on the patient. So can we impart telehealth so that instead of you having to figure out how to see one patient in a 1 hour span, which we know from billing purposes, it's usually 15 minutes, but just work with me for the purposes of illustration. Can we get you to see 3 or 4 by using technology? And then, on top of that, care coordination. Oftentimes you'll have a patient or an individual, they go to care into one place, have to try to figure out how to get records to their next physician. So can we have communication across the board? Can we do proper handoff? And so when we do all those things, you start seeing that we're able to do more with that less. We've been able to shave off hours as a result of that, because before we had to, okay, will someone accept the patient? Is the patient ready? What do we do? Instead, we're able to call through the system. Psychiatrist is able to look that patient, eye on video, have a discussion, and say, you know what, this individual really needs to be on a hold, what we call Baker Act. It's within the Florida law. I'm sure you're aware of it. And involuntary hold for at least 72 hours and or max 72 hours. So from there, we're able to say, okay, let's transfer you to the behavioral health hospital. So that's a perfect example of how we use telehealth. We also do so with our stroke, anyone who comes in with stroke. So we immediately triage. Staff comes in, we have a team ready to stabilize that patient. And we're able to do neurology, have our neurologist take a look at those for those individuals for any needs, any immediate needs, or needs that may require them to, okay, let's see you. Let's see how you're functioning. And we can order tests and go from there. So those are just some examples of how we use technology.
That's amazing. Dr. Sri, we do need to take another break. We will be right back. You are watching Black Health. We are talking about safety net hospitals and health equity with Dr. Sandra Sevier of Jackson North Medical Center. We'll be right back.
Welcome to the city of Miami Gardens, where purpose meets opportunity. From building tomorrow's infrastructure to answering the call when it matters most, to creating vibrant spaces and smart growth, every role counts. With 4-day work weeks, 100% paid health benefits, generous PTO, and a Florida pension plan, the city of Miami Gardens puts you first. Join the team that's shaping the future.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman and Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids, matters, because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. The Mesman and Dover Law Firm, youraccidentattorneys.com.
The Great Jamaican Jerk Festival, presented by Publix and VP Records, is back on Sunday, November 9th at Miramar Regional Park. Come enjoy mouth-watering jerk cuisine, exciting culinary demonstrations, and live performances featuring the Wailers, Romaine Virgo, Destra, and Mr. Vegas. Tickets on sale now at jerkfestival.com. The Great Jamaican Jerk Festival. Come for the food, stay for the fun.
Brought to you by these fine sponsors.
Welcome back. You are watching Black Health. We are with Dr. Sandra Sevier. Dr. Sevier, changes to healthcare policy can deeply impact patients who rely on Medicaid and other safety net programs. How can a health system like Jackson North protect access to care and maintain equity regardless of the political climate?
So, one of the things I would say is, how do we protect it is, number one, hospitals are required to do what's called a community health needs assessment. And we've done a lot of partnering with different agencies within the community to understand the needs Once we get that, of course, utilizing data to show what impacts what impact we're having in the healthcare sphere for those patients. And then we work with government agencies to ensure that funding is protected. And that's one of the key things. I have to say this. We often don't realize that government is local. And so, we talk about the presidency, we talk about, our state, not state, but rather United States senators, and not necessarily within your own state. So we really work closely with our government officials within our county to ensure that our funding is protected. Another big part of that is diversifying our funding. So we rely on tax dollars, we rely on federal and state income, but a big part of what we do is ensure that individuals who are insured understand that they can receive high quality care at Jackson. And from that, we diversify the funding pool so that it allows and offers more protection with our funding so that we can provide care. So that's a really big part of that. Also working with our community partners, as I mentioned before. So for instance, with our FQHCs, ensuring that we have a linkage there for a lot of our patient population. And then of course, prevention. The best way
Yes.
To be able to serve
Mhm.
multiple people is to ensure that others are healthy.
Yes.
So we're not practicing, we're very big on practicing reactive medicine in our country. So now more and more, and even insurance partners are seeing the benefit of prevention. So that's how we have to do it. Diversify our funding pool, continue to work with our local governments and promote prevention.
I think we're coming up on time, but one quick last question. What do you see as the biggest challenge and opportunity facing safety net hospitals over the next 5 to 10 years? And what is your biggest challenge as the CEO of a safety net hospital?
It just kind of dovetailing back on what I was just saying, it's reliance on government funding only. That's really one of the biggest challenges because we've done such great work at Jackson North. And I'm incredibly proud of the brand lift that we've done, how we've built trust with the community. Do we have work to do? Absolutely. But that trust is key. And by really diving into the community, I think that's really one of the biggest opportunities to really keep us safe, keep us whole, because that is what funding really is the challenge. Bottom line, healthcare is still a business, and a lot of people don't realize that. So we have to, just like any other business, we have to have adequate funding to survive and also have political backing. Because, as we're seeing right now, there's so much contention in how do we move healthcare forward in our country.
Absolutely. Well, thank you for that, Dr. Severe. We are at the end of our show. Thank you so much for being here and representing Jackson North Medical Center, which I know is a part of the larger Jackson Health System. I did my training at the main Jackson, and I know you have several locations throughout Miami and South Florida. So thank you so much for taking time out of what I know is a very busy schedule to be CEO of an entire hospital. So thank you so much, and also for imparting this valuable knowledge to our community.
It's been my pleasure. Thank you for having me.
Absolutely. And thank you for watching Black Health, everybody. We will see you next time. Take care.